Hello, I'm Dr. Linda Eckert, and I'm a professor of obstetrics and gynecology at the University of Washington in Seattle. And today we're going to talk about vaccine communication for the obstetrician gynecologist. Specifically, this vignette is going to deal with conversation strategies when we think about how to talk to our patients in our office setting about vaccine use. So when we go to having the conversation with our patients, study after study after study has shown that the sole most important factor for patients to consider when they are deciding about whether or not to receive a vaccine is the strength of the recommendation of the provider. So you want to give a recommendation that is strong. You want to say, today is the opportunity to have this flu vaccine, and I really think that this is a great vaccine for you, and then go ahead and tell them why. And so, again, the provider recommendation is key. What other things have been shown to be helpful is the style of recommendation. And actually, studies again have shown that if you assume acceptance, that is actually a better style of recommendation. For instance, you want to say, okay, today you're 28 weeks, it's time to have your Tdap in pregnancy. You don't want to say, okay, today you're 28 weeks and there's a recommendation to give you your Tdap in pregnancy. What do you think about that? You do, of course, want to allow patients to ask questions, and I'll talk about that later. But what I mean is that when you offer the vaccine, you want to be strong in your recommendation, and you want to assume acceptance. You don't want to assume a defensive policy. So after you've made your recommendation to your patients, you want to anticipate the most frequent concerns. And of course, when you're giving immunizations in general, but specifically immunizations in pregnancy, safety, safety, safety. That is what patients want to know about. Is this vaccine safe for my baby? Is this vaccine safe for me? And so the good news about flu vaccine is we've been giving this for decades. We have multiple studies now that show there's no increased risk in miscarriage, preterm labor, small first gestational age, birth defects. There's a plethora of studies. Also, just since the H1N1 pandemic, there has been a whole new round of studies. And so the flu vaccine's been looked at in multiple countries, multiple types of study designs with different adjuvants, different vaccines, and there's never been any sign that it isn't safe in pregnancy. As far as Tdap, I think some of the questions relate to why do I have to get this every pregnancy, and is it safe for me to get every pregnancy? And what I like to tell patients essentially is that when you get the Tdap, you get a big boost in your antibody, but unfortunately the levels wane pretty quickly. So out here, even by 1 year, the levels in your own bloodstream have dropped to the point where you're not able to pass a large amount of antibody onto your baby, not enough to allow the baby to be protected as well against pertussis as you would like the baby to be in the newborn period. So then when we give you another injection and you boost your antibody level, then for that particular pregnancy, you're safe. So the story with Tdap, why you need it every pregnancy, is to keep the baby protected against pertussis at the best level that we can. And the good news is it's safe to be used in pregnancy. As far as HPV vaccine, what I tend to ask is what have people heard, but also I talk about the denominator. For HPV vaccine, we now have given over 80 million doses globally of this vaccine. And in that 80 million doses, there haven't been any safety signals that have been consistently shown. There's been thorough investigation of many concerns, and this is actually one of the safest vaccines we have. And so I tell people, gosh, there's been 80 million doses given. That is a lot of doses, and so far we haven't seen any safety concerns. So I definitely do try to reassure patients about the safety of these vaccines. This is a slide of some of the most recent flu vaccine safety studies, and in no way is this an exhaustive list. There's many, many more studies, but just to give you an example of some of the studies that are out there, some of the numbers in them, look at this, 74,000 people, 10,000 people, 18,000 people. These are large, really well done studies that have not shown any increased risk of adverse events in pregnancy. Now, this is a study also I like to talk about with my patients if they're having difficulty understanding why they should get the flu vaccine in pregnancy. This was published in the New England Journal of Medicine, and this was a large trial of 113,000 pregnancies that was done in Norway. They have a very good pregnancy registry there, and they can track everybody and follow all complications. And this happened with the pandemic flu vaccine. And in this study, what they found is that if you got the flu vaccine, A, it decreased by 70% your risk of getting flu. So A, the vaccine worked. And B, if you did get the flu, the risk of fetal death, not just maternal harm, but fetal death, was increased with a hazard ratio of 1.91. In other words, there was almost twice as much risk of the fetus dying if the mom caught the flu. So this study headline is that getting the vaccination of flu vaccine is much safer than getting flu during pregnancy. Okay, so what leads to the perceived need of the patient wanting to get vaccination? For one, the perceived risk of the illness. I think when we see a widespread epidemic, like with a pandemic of H1N1, or when we had the measles outbreak that occurred in this country because of the exposures that happened at a very popular theme park, or when we have pertussis epidemics, for instance, in the state of California or Washington, and it hits the news, there's an increased perceived risk of illness. Additionally, for instance, with the HPV vaccine globally, if you look at in countries, for instance, in Africa, they are begging for this vaccine because they know so many people who've died of cervical cancer. So part of what leads to a need for vaccination is the perceived risk of the illness. Another thing is the likelihood of the illness. Do patients say like, oh, I've never gotten the flu, you know, why should I get this vaccine? And what I like to bring up is that the flu is not equal to the cold. You know, the flu vaccine will not protect against the common cold, but when you get the flu, you're going to feel like a truck hit you. That this is, if you've ever had the flu, you know you don't want it again. It's not the common cold. And so I talk about really the illness and how bad it is, and that's a reason to try to get the flu vaccine. Another thing is to look at the effectiveness of the intervention. Clearly, the more efficacious a vaccine is, the easier it is to tell the patients that they'll be protected. You know, we have really good data for Tdap in pregnancy protecting against pertussis. We have data for flu that I just showed you, and of course the HPV vaccine is 99.5% effective, protecting against the HPV types that are in the vaccine, which is super high efficacy. So these are also factors that I bring up in the conversation. Now, what about creating an atmosphere that is a good atmosphere for discussing vaccines? And these are focus group studies and other studies that have been done that says that what patients really want, of course, not surprisingly, is to be listened to as individuals. They want to think that their questions are unique to them, the answers you give are unique to them, that you understand their particular setting and their concerns. I often say, what kind of information would be helpful to you? And that helps me target my answers after I do my, you know, general introductory spiel of I think you should get the flu vaccine because it'll help you and it'll help your baby. So what other information would be helpful? Sometimes what have you heard? There may be a lingering doubt because of a media report or a friend that has told them something. And, you know, I often want to know directly, like, what have you heard? And then the other thing is to embed vaccines just into your routine procedures. And this will also help with improving the atmosphere for vaccination in your office. For instance, we always do our Tdap when we do our glucola in the third trimester, and it just kind of creates it as a routine procedure, makes it easier to talk about, and it comes up then specifically with a glucola, and you don't have to try to remember it independently. Lastly, I just want you to realize there's help with the scripts of what you're going to say to your patients. The American College of OBGYN has this wonderful website, immunizationforwomen.org, and on this website there are scripts that you could use to help you with talking points for your patients. I put the one up here about Tdap. There's also ones about flu. There's a flu toolkit. There's the HPV toolkit. There's frequently asked questions, and there's information about all of the other vaccines as well. So I would encourage you to access this website and to use it. It can be very helpful for you in anticipating and discussing with patients vaccines. You're not alone, and people have struggled with this before, and there are really good tips and help available. Thank you very much.